Since its establishment by His Excellency, the Executive Governor of Kogi State, Alhaji Yahaya Adoza Bello, on April 24, 2019, Kogi State Health Insurance Agency has made a lot of inroad in fulfilling its core mandate of delivering quality and affordable healthcare services to Kogi people. As at today, the agency has enrolled 32,159 enrollees in its Basic Health Care Provision Fund program, which cut across the 239 wards in the state. A good number of the vulnerables in Kogi State are accessing quality healthcare services. On His Excellency Alhaji Yahaya Adoza Bello's healthcare program tagged Bello Care, the agency has registered 13,707 enrollees, which cut across the 21 local government areas of the state, and the enrollees are already enjoying quality health care in the 21 local government areas of the state. The agency also enrolled 172 political office holders with their 494 dependents who are already accessing quality health care. At the moment, Kogi State Health Insurance Agency has almost concluded arrangements for the takeoff of the former sector plan known as FOSEC with Kogi State civil servants. The agency, in its preparation for the takeoff of the former sector for Kogi State civil servants, recently held an interactive session with the leadership of the Kogi State Organized Labor. During the interactive session, the leadership of the Organized Labor, led by its chairman, Comrade Gabriel Amari, agreed that the former sector plan is good for Kogi State workers and is long overdue for implementation. Comrade Amari said,
is Comrade Amari Gabriel. From the interaction today, I think we are well equipped, especially the benefit the workers of Kogi State stand to derive from the project. Without much delay, we are going to give government the support so that this project will commence in an earnest.
On her part, the chairperson of Kogi State Women Wing of the Nigerian Labour Congress (NLC), Comrade Abibat Umar Ibrahim, described the former sector plan of Kogi State Health Insurance Agency for Kogi State workers as very commendable. She also said,
sensitization and interaction has been worthwhile because what we never knew about the program today has been analyzed to us. We've been told about the benefits to civil servants, and definitely I know when we go back to our various unions and organizations, we'll be able to explain to them and to tell them that it's a must that we must key in because it's beneficial to all civil servants and their families.
The chairman, Kogi State Negotiating Council of the Organized Labor Union, Comrade Victor Alemeru, described the former sector plan for Kogi State workers as the best. He urged the Kogi State Health Insurance Agency to work towards the full implementation of the plan for the workers. He further stated that,
first, let me appreciate the effort of His Excellency Alhaji Yahaya Adoza Bello for even approving the sum of 180 million for this agency to start this program. We are happy. What else do you need rather than to start contributing our own 3.5%? Initially, what we had some issues with government. We wanted them to satisfy some conditions, but now almost 80 to 85 of these conditions have been satisfied. So I think the program can start now.
On his part, the board chairman of Kogi State Health Insurance Agency, Pharmacist Suberu Ariko, thanked the organized labor in Kogi State for their cooperation with the agency in the continued negotiation for the full implementation of the former sector plan FOSEC. He emphasized the importance of the plan in reducing out-of-pocket expenses on healthcare by workers. Pharmacist Ariko also said,
I am Pharmacist Ariko Suberu Ahmed, the board chairman of Kogi State Health Insurance Agency. We are very impressed and we thank God for today's interaction session with the leadership of labor in the state over the plan to commence the former sector for the health insurance agency, that is the civil servants. Well, as you have all seen from the beginning of the session, It has been a very robust interaction and discussion, and from the presentations made by the Executive Secretary, Dr. Ali Dari, it is obvious and clear that virtually everybody present to this interaction is convinced of the benefit package that is inherent in the health insurance scheme for the formal sector, that is civil service in the state.
On the successful deliberation of the interactive session between the agency and the organized labor, the Executive Secretary of Kogi State Health Insurance Agency, Dr. Adekunle Aledari, said it was a huge success. He stated that both Kogi State Health Insurance Agency and the leadership of the organized labor in the state agreed that the enrollment of Kogi State civil servants for the formal sector should commence. He further said,
the objective of this meeting is to sensitize the new executive on the formal sector health insurance plan for civil servants, also known as FOSCARE, and at the same time to discuss the modus operandi of the program. So we had a very robust interaction. They've been able to understand the benefit of the health insurance program. At the end of this meeting, we have unanimously agreed that we should actually commence sensitization for the civil servants across MDA, at the same time commence enrollment to enroll all the civil servants and their dependents into the scheme, while we are still talking about how to commence deduction from their salary. So it's a work in progress. We are taking another bigger step to see how we can commence enrollment, and with the support of the Office of Head of Service, we have gotten that support that it's actually timely for us to commence enrollment in preparation for access to healthcare services.